neutrophil is going to kind of look like this. The nucleus is going to be segmented. An average neutrophil has somewhere between 3 to 5 lobes. This one I have 1, 2, 3. I could have made it 4, I could have made it 5. I'm good that way. Okay. And each of the lobes are connected by a little thin strand, or isthmus. Okay, so this is, it's got multiple lobes within the nucleus. Just one nucleus, but it's segmented. We say that the nucleus is segmented. Okay? So, the official name of a neutrophil is a polymorphonuclear leukocyte. Why? Because different leukocytes, different neutrophils have different appearances to their nucleus as a result of this segmentation. No two neutrophils look alike. Okay? Now, you can also call them polys, or polymorphonuclear, or segmented neutrophils, or some people just call them segs. Segs and polys, you hear that a lot. But basically, these are all neutrophils. These are just AKAs. Now, we said they're the most abundant. You don't need to memorize percentages, but certainly they're the most abundant. In almost all cases, they account for over 50% of the circulating white blood cells. Now, if you remember, when I showed you the development of red blood cells, we started with the stem cell, and we went through 5 different generations. Okay? For instance, here was the reticulocyte, and here was the mature red blood cell. Okay? The same thing happens with white blood cells. They go through a series of generations before the mature, in this case, neutrophil is reached and released into the bloodstream. Now, the immature neutrophil stage that occurs just before differentiating into a fully mature neutrophil is called a band. It's called a band because its nucleus looks like this, like a band. It hasn't yet segmented. Okay? This is the stage at which neutrophils are released into the bloodstream, at the band stage. Now, once they reach the bloodstream, this band is going to begin to do what? To segment, like that. And if we wait another day, it's going to segment further, so it begins to look perhaps like this. Okay? So as it matures, it goes from a band to a clearly adult differentiated neutrophil. So play this game with me. A band is to a neutrophil as a blank is to a red blood cell. Reticulocyte. Okay? In each case, whether we're talking about the band or reticulocyte, it's the immature stage which is first released into the peripheral bloodstream. In each case, it takes about a day or two for that immature form to fully mature. So if the bone marrow is responding to an acute bacterial infection, okay, with the development of a granulocytosis, a lot of those brand new white blood cells are going to be what? Bands. Okay? And so when you see the differential on the CBC report, they will not only report adult neutrophils, but they'll add a new column for a percentage of bands in mature neutrophils. And so in the setting of acute bacterial infection, you not only have a granulocytosis, but you have what we call a shift to the left. When we say a shift to the left, we mean a greater proportion of immature cells to the left of the mature neutrophil. Okay. So you will hear in a hospital setting, like you'll see, oh, this person's got a granulocytosis with a left shift. What they're trying to say by that terminology is this person probably has an acute bacterial infection. So someone who comes in with acute appendicitis, they're going to have a granulocytosis with a left shift. That's just the way it is. Now, sometimes you'll have a neutrophilia. I'm going to throw in an increase in neutrophils with a non-bacterial inflammatory process. Like you could have a flare-up of lupus or rheumatoid arthritis. Okay? This is a disease that's not caused by bacteria. It's not an infection, but it's a systemic inflammatory process. Well, that can also lead to a granulocytosis, an acute inflammatory response. I picked out this neutrophil to demonstrate because it looked kind of happy. Doesn't it look happy?
Yeah.
Okay. And you can see it's got 3 different segments. You don't always see the little isthmus, the little strand between, but this one we do. Now, in neutrophils, this is a granulocyte, but typically the granules are very subtle, lilac colored. Here we can clearly see the granules, but in some of the smears that you'll look at, they'll be hard to see. They won't be quite as obvious. Okay? So notice that this neutrophil, this white blood cell, is larger than the surrounding red blood cells, and that's fairly typical. And then, look, we have a little friend here. What is that thing there?
Bacteria.
A platelet, yes. So we see all 3 formed elements here, red blood cells and white blood cells and platelets. Oh my. Oh my.
Why don't we see more
Why don't we see more
platelets?
platelets? It depends on this, you're going to move from section to section in the smear, and in some sections you'll see a lot more. This is just a very, very small sample. There's a band. I like to say it's a band on the run. Have y'all heard that song?
Yeah.
Yeah, Paul McCartney. Alex, have you ever heard that song, Band on the Run? Okay, so it makes sense. to you. You just didn't think it was funny. I understand. That happens. Yeah, listen, they can't all be, diamonds. They can't all be. Most of the time they're not. Most of the time it's all right, let's keep going.
Is that red blood cell to the left of it, is that hyperchromic? The one below it.
Yeah, this looks, if you just look at this, that looks hyperchromic. Now, you got to look at multiple sections. When you're looking at smears, you're going from 1 to 2, you're going from multiple sites. These could be just 2 isolated red blood cells, which means nothing.
Okay.
But if you see a lot of these, then you would take notice. All right, second most abundant, lymphocytes. Okay? Typically, they make up less than 50%, but still a significant quantity of your red blood cells. We can subclassify lymphocytes, by the way, into 2 different types, T cells and B cells. And we'll learn about these when we talk about immunity. But under light microscopy, you would not be able to differentiate T cells from B cells. They look the same. T cells are involved in viral-mediated infections. In other words, when we get a virus, we typically generate a T cell response, a T lymphocyte response. T cells are involved in suppressing tumor cells and the attack against foreign tissue, rejection. For instance, if I received a kidney transplant from a donor, okay, and we didn't have an exact match, my immune system's going to attack, and it's going to be brought about by T lymphocytes. Yeah, it's going to cause rejection, unless you suppress my immune system. Okay. So T cells, though, in these various attacks, attack directly. They go to the site of invasion, and they attack. B cells, and that's called, by the way, cell-mediated immunity. Cell-mediated immunity. Whereas B cells are involved in a little bit different way. When B cells are presented with some type of foreign pathogen, if they recognize, for instance, a bacteria or a virus, they differentiate into a different type of cell, a plasma cell, which begins to produce antibodies. So it's more of an indirect attack. These antibodies are released into the bloodstream and then coat that foreign agent. But it's not a direct attack by the B cells. It's coating by antibodies which are produced by B cells. That type of response, mediated by antibodies, is called a humoral response. Not cell-mediated, but humoral. So, cell-mediated immunity, humoral immunity. Now, because lymphocytes are involved in viral infections, it's not uncommon that if someone presents with a virus, instead of having a granulocytosis with an increase in neutrophils, the CBC will reflect a lymphocytosis, an increase in lymphocytes. So if you're a mother and you bring your small child in with a fever to the pediatrician, and he does a little blood test, and he sees that it's a lymphocytosis, he's gonna say, okay, just make sure that the baby gets plenty of fluids. Okay, you give any Tylenol for fever, and call me if there are any other problems. And of course, the mother's going to get upset. Why? What does she want?
Antibiotics.
She wants antibiotics. But antibiotics are only good against bacteria. And the physician has determined that this is a viral infection because there's a lymphocytosis. Mom doesn't understand that. Okay? She needs a lot of reassurance. But if still that doesn't do it, ultimately, what does the pediatrician do?
He has to explain it to her.
He either has to explain it to her, stand the ground, or sometimes they just
Give
give
it antibiotics.
Even though it's not really gonna work.
Even though it's not going to do anything. And that's not a good thing to do
Right, because you shouldn't take them
if you don't need them, right? And so, but, you know, if you have a patient who's angry enough and ultimately you just give the antibiotics. Unfortunately, that's what happens.
Right.
Now, lymphocytes look different. Notice that the nucleus is nice and round and spherical and takes up almost all of the cell. So there's only a very thin rim of cytoplasm around the nucleus. Sometimes it's hard to see that thin rim of cytoplasm. The other thing you have to recognize is that the nuclear material, the chromatin, is dark and homogeneous. In other words, there's no dark and light areas. It's all dark. It almost looks like a solid consistency. So it's dark and dense and takes up most of the cell. And then what are these four things here?
Wait.
5 platelets. Perfect. Praise the Lord. Now, monocytes are the biggest and the baddest of the white blood cells. They become macrophages. How much bigger is a monocyte than your other white blood cells?
Pretty big.
Well,
Double?
Well, it could be double. It could be fairly large, 1.5 to 2 times. I'll give you an analogy. Suppose you're sitting on a plane, you're bored already. Okay. Perhaps you're on the end seat, and you see somebody walking down the aisle who's like 400 pounds. Okay. What is your fear?
Gonna sit next to you.
No, not getting run over. Your fear is what?
Sit next to you.
That their seat is right next to yours. Okay.
Always.
Well, that person, as obvious as that person is, how you pick up, oh, I don't want that person to sit here. That's how monocytes are. Okay, because of their size, it helps to pick them out from the other types of white blood cells. Okay. They make up 3 to 8% of the white blood cells. When they enter into the tissue from the bloodstream, when they undergo diakinesis, they differentiate into macrophages, which are active in phagocytosis. Okay? In an acute bacterial infection, okay, the first cells to arrive are neutrophils. But if you wait a couple of days, a few days, then reinforcements in the form of monocytes begin to show up. And so the monocytes that differentiate the macrophages, they're capable of eating bigger particles. So they'll clean up what hasn't been cleaned up by the neutrophils, and if there's any cellular debris, they'll eat that as well. Okay? Now, they're active against viruses, against atypical bacteria like tuberculosis, and because they come around after the acute phase, you see them in chronic infections. I'll give you an example how this would be pertinent. Let's suppose you have a young teenager comes into the hospital with right lower quadrant abdominal pain. What's the first thing you're thinking of? That scenario. Teenager, fever, nausea, vomiting, right lower quadrant abdominal pain.
No,
That's
appendix.
over here.
Appendix.
Appendicitis. Appendicitis. So that patient may go directly to the OR, and when we open her up, okay, the surgeon is going to palpate the appendix, and it's going to be red and swollen, and he's going to say, oh, I have a hot appendix. Because physically, it feels hot. It feels warm. So we say this is a hot appendix. Now, he is going to remove the appendix, do an appendectomy, and that specimen is going to go to the pathology lab, where they're going to make thin slices of the tissue, stain it, and put it on a slide, right? So that can be reviewed by a pathologist. The pathologist may not know the patient. He may not even have a label on the slide, but he'll look at it and he'll interpret what he sees. And he'll recognize first that the tissue is the appendix, and then he'll see that there are lots of white blood cells, so he'll recognize that this is an appendicitis. But then he's going to look at the specific type of white blood cell. And if all he sees is a sea of neutrophils, in his report he's going to dictate this is acute appendicitis. If he sees an even distribution of neutrophils and monocytes and or macrophages, his interpretation is going to be different. He's going to describe